panel discussion. Thank you.
Thank you so much. Thank you. Good morning, everyone. My name is Tahera Hasan, and I'm going to be the moderator for today's panel, Empowering Women's Choices. Just a little introduction about myself. I'm a lawyer by profession, and I run an NGO called Imkaan Welfare Organization, and we work a lot on citizenship and identity issues, and our focus of a lot of our other work is women and children. So this panel is extremely close to my heart, and I am very happy that we are here today to have this discussion. We know that women's autonomy over their health, careers, family, and life decisions is central not only to their well-being, but to the development and progress of our society. Today we have an incredible panel of experts who work across different sectors, each bringing a unique perspective, and we can bringing a unique perspective on how we can expand the choices women can make and protect their rights. Our aim here is to discuss both the barriers that women face, but also look at the steps that can be taken through policy, advocacy, and community action to ensure that women's voices are central to the population and development agenda. I'd like to introduce our panel, our inspirational panel. Now that the order has changed, Tahera Abdullah, who's a development researcher, practitioner, rights defender. We have Aisha Laghari, Country Director of Population Services International in Pakistan. Dr. Yasmeen Sabi Qazi, Chief Executive, QZ Catalyst. Shamamatul Ambar Arbab, former President, Women's Chamber of Commerce and Industry. And Madiha Latif, who is from Pathfinder. I'll start with Tahera Saiba. Tahera Saiba, just to pose, a question to you to get the conversation started. You have repeatedly highlighted in your work how women's unpaid work is invisible in policy. If you could choose one policy shift to make women's labor visible and valued, what would that be?
बहुत शुक्रिया. सबसे पहले अस्सलाम अलैकुम और डॉन मीडिया और पॉपुलेशन काउंसिल का बेहद शुक्रिया. हमेशा की तरह कोई ना कोई ऐसा एक अहम मौजू चुना जाता है जो कि ना सिर्फ ये कि अहम है और ज़रूरी है और लाजमी है, बल्कि अब पाकिस्तान के लिए आबादी के तवाज़ुन का मौजू एक एग्जिस्टेंशियल थ्रेट या एक एग्जिस्टेंशियल चैलेंज या एक एग्जिस्टेंशियल मौका या अपॉर्चुनिटी बन गया है. तो आपका बहुत बहुत शुक्रिया. आप अगर इजाज़त दें तो मैं कोई आधा मिनट लेना चाह रही हूँ आपके सवाल पर आने से पहले. ये कहने के लिए मुझे इजाज़त दीजिएगा, आप तमाम दोस्त साथी जो यहाँ जमा हैं, कि जब हम मज़हब की बात करते हैं तो हमें एक मज़बूत प्लेटफॉर्म मिलता है जिसको बहुत सोच समझकर इस्तेमाल करना चाहिए. और जब हम किसी चीज़ की इजाज़त देते हैं तो वो मशरूत नहीं होनी चाहिए. इजाज़त होती है, प्रोहिबिशन होती है, पाबंदी होती है. और जब हम इजाज़त देते हैं तो वो एक मॉरल बैकग्राउंड से होनी चाहिए, एक एथिकल बैकग्राउंड से होनी चाहिए, वो एक राइट्स बेस्ड बैकग्राउंड से होनी चाहिए, एक ट्रांजैक्शनल बुनियाद पर नहीं होनी चाहिए. अगर किसी औरत की सेहत ठीक नहीं है तो वो बर्थ स्पेसिंग कर ले. आई एम सॉरी, दैट इज़ नॉट एक्सेप्टेबल. बस मैं इतना कहना चाह रही हूँ. और अब मैं आपके सवाल की तरफ आती हूँ. बहुत कुछ है कहने को. कल सुबह से हम में से कुछ लोग कल सुबह से बैठे सुन रहे हैं. आदाद व शुमार की भरमार थी, डेटा, स्टेटिस्टिक्स, इंफॉर्मेशन, एक एवलांश था हमारे ऊपर. तो इसलिए आपको सुनकर खुशी होगी या रिलीफ और इत्मीनान होगा कि मैं ना डेटा, ना स्टेटिस्टिक्स, ना कोई किसी किस्म की उस तरह की कोई टेक्निकल प्रेजेंटेशन करने जा रही हूँ, क्योंकि वो हो चुकी पिछले सवा दिन के अंदर. लेकिन एक अदद बोलने की इजाज़त चाहूँगी, और वो ये है कि 12 सेशंस में एक सेशन औरतों के लिए मुख्तस किया गया, लेकिन उस सेशन को बाकी तमाम 1 घंटे के लिए और 7 ख़वातीन को बोलने के लिए 30 मिनट दिए गए हैं, जो कि मुझे बताइए कि 48.9% ऑफ पाकिस्तान की पॉपुलेशन के लिए, इज दैट जेंडर इक्वालिटी, इज दैट जेंडर जस्टिस, इज इट फेयर? आई लीव इट टू द ऑडियंस. अब मैं आ रही हूँ आपके अनपेड लेबर औरतों का. अगर मुझे कहा जाए कि सिर्फ एक तुम्हें चॉइस दी जाती है कि तुम एक बताओ हमें कि वो क्या इक़दाम होना चाहिए, वो कौन सा स्टेप होना चाहिए, या वो कौन सा एक एक्शन होना चाहिए जो कि आबादी का तवाज़ुन भी कायम करे, अभी नहीं है, और औरतों को बाइख्तियार भी बनाया जाए, अभी नहीं हैं हम. वो तो नज़र ही आ रहा है. तो मैं सिर्फ एक लफ्ज़ बोलूँगी और वो ये है, गुर्बत को ख़त्म किया जाए और उसमें फेमिनाइजेशन ऑफ पॉवर्टी को ख़त्म किया जाए, क्योंकि अक्सर ये लोग जानते नहीं हैं. आपने कल से हम सुन रहे हैं कि वर्ल्ड बैंक 44% पॉवर्टी का जिक्र कर रहा है, लेकिन ये बात किसी ने आज कल सुबह 10 बजे से लेके आज क्या टाइम हो गया जो भी नहीं जिक्र किया कि उस 45% गुर्बत की शरह के अंदर एक चीज़ है जिसको बोलते हैं फेमिनाइजेशन ऑफ पॉवर्टी, जो कि बताता है कि उस अदद गुर्बत के उस शरह में पूरे पाकिस्तान की 250 मिलियन की आबादी में फेमिनाइजेशन ऑफ पॉवर्टी उसको बोलते हैं जिसमें हम ख़वातीन की शरह को देखते हैं. और ये अगर मैं कह रही होती तो आप लोग कहते कि भाई ये तो राइट्स एक्टिविस्ट है, ये तो फेमिनिस्ट है, ये तो पता नहीं रेडिकल भी शायद होगी, रा किस्म की रेडिकल भी शायद हो, खुदा ना ख्वास्ता. तो खुदा ना ख्वास्ता इज़ एन इन्वर्टेड कॉमर्स. तो शायद इसने कोई अपने जहन से कोई ये अदाद व शुमार निकाल लिए. नहीं, ये फेडरल मिनिस्टर फॉर वुमेन्स डेवलपमेंट एंड पॉपुलेशन ने पाकिस्तान डेवलपमेंट, डॉक्टर इशरत हुसैन साहब मौजूद हैं, डॉक्टर अमजद साहब मौजूद हैं. आप लोगों में से कुछ लोगों को याद होगा कि एक चीज़ हुआ करती थी, पाकिस्तान डेवलपमेंट फोरम, और अच्छे दिनों में उसको पाकिस्तान में मुनाकिद किया जाता था, अब नहीं होता फॉर सिक्योरिटी रीजंस और व्हाटएवर. तो उसमें एक फेडरल मिनिस्टर ने कहा था कि फेमिनाइजेशन ऑफ पॉवर्टी की शरह है 3:1. हर एक पाकिस्तानी मर्द जो कि गुर्बत में है उसके लिए 3 पाकिस्तानी ख़वातीन गुर्बत में हैं. इन अदर वर्ड्स, जो लोग रेशियोज और रेट्स नहीं समझते या इस तरह नहीं, तो साफ अल्फाज में कह दूं कि 45% पाकिस्तान जो इस वक्त गुर्बत में है उसमें से 75% औरतें हैं, और ऑब्वियसली बच्चियां और ट्रांसजेंडर्स. तो इसको अगर किया जाए, और इसकी सबसे बड़ी बात, कल से हम ये आदाद व शुमार सुनाई जा रहे हैं कि विमेंस लेबर फोर्स पार्टिसिपेशन रेट बहुत नीची है, 22% है. एक्सक्यूज मी, आपके सरकारी आदाद व शुमार में तो शायद 22% होगी, लेकिन मैं आपको बता दूं कि 100% पाकिस्तानी औरतें, बच्चियां, ट्रांसजेंडर्स काम करती हैं. आप उनको शुमार और कितार में लाएं ना लाएं, लेबर फोर्स सर्वे में काउंट करें या ना करें, वो रजिस्टर्ड हो या ना हो, उनको मुआवजा, रिम्यूनरेशन, पेड वर्क हो या ना हो अकॉर्डिंग टू ILO डेफिनेशन. लेकिन हमें अब वक्त आ गया है कि हम अपनी अनपेड एग्रीकल्चरल लेबर, लाइफ स्टॉक लेबर, फिशरीज लेबर, फॉरेस्ट्री लेबर, तमाम होम बेस्ड वुमेन वर्कर्स, होम बेस्ड अर्बन वर्कर्स, जिनको या तो बिल्कुल तनख्वाह और मुआवजा ही नहीं मिलता या एक्सप्लॉयटेटिव रिम्यूनरेशन है या है ही नहीं. वी हैव स्लेव लेबर, बॉन्डेड लेबर, ब्रिक किलन वर्कर्स. टाइम नहीं है क्योंकि हर एक के पास महदूद वक्त है, लेकिन इसके ऊपर मैं समझती हूँ कि अगर डॉन मीडिया पूरा का पूरा एक 3 दिन की कॉन्फ्रेंस भी रखे तो वो कम पड़ जाए. इनको काउंट किया, मेरी तरफ से रिकमेंडेशन ये है, और मेरे जैसे मुझसे बहुत बड़े लोगों की रिकमेंडेशन, मैं तो छोटा मुँह और बड़ी बात, इनको काउंट किया जाए, इनको रजिस्टर किया जाए, इनको जीडीपी के अंदर डाला जाए, इन तमाम अनपेड या लो पेड या इनडिसेंटली एक्सप्लॉयटेटिवली पेड वर्कर्स को EOBI ऐसी वर्कर्स वेलफेयर फंड के अंदर शुमार किया जाए और इनको तमाम वो मराद दी जाएं जो कि लेबर फोर्स सर्वे के अंदर फॉर्मल ऑर्गेनाइज्ड लेबर फोर्स को दी जाती है एज अपोज टू नॉन फॉर्मल अनऑर्गेनाइज्ड नॉन यूनियनाइज्ड लेबर फोर्स. इनको कलेक्टिव बार्गेनिंग एजेंसी दी जाए. बहुत कुछ कहने को था लेकिन उसको मैं छोड़ देती हूँ. मैं बस इतना कहना चाहती हूँ कि हम कंट्रोल की बात नहीं करेंगे, पॉपुलेशन को मुतवाज़न करने की बात करेंगे, तरक्की की बात करेंगे, एम्पावरमेंट की बात करेंगे, रिप्रोडक्टिव राइट्स की बात करेंगे, रिप्रोडक्टिव एंड सेक्सुअल हेल्थ की बात करेंगे, कंट्रोल की बात नहीं करेंगे, जो कि हमने 1994 में कायरो में ICPD में एक प्लेज किया था, एक ओथ लिया था. And Mohtarma Shahid Benazir Bhutto led the Pakistan delegation to Cairo 1994 ICPD. अब हम पॉपुलेशन कंट्रोल नहीं करेंगे, स्टेबलाइजेशन और बैलेंस की बात करेंगे. और इसके लिए हमें लाइफ स्किल्स बेस्ड एजुकेशन चाहिए. हमें सेक्स एजुकेशन पाकिस्तान के आजकल के मुआशरे में एक्सट्रीमिज़म, रिलीजियस एक्सट्रीमिज़म का जो मुआशरा है, ब्लास्फेमी का जो मुआशरा है, उसमें अब हम लाइफ स्किल्स बेस्ड एजुकेशन की बात करें, पॉपुलेशन स्टेबलाइजेशन की बात करें. हम बिल्कुल भी सेक्स एजुकेशन अपने बच्चों को, ख़ास तौर पे स्कूल के बच्चों को नहीं सिखाएंगे. आपका बहुत शुक्रिया.
शुक्रिया बहुत बहुत ताहिरा साहिबा. और ये जो कॉन्वर्सेशंस हैं और जो बातें आपने की हैं वो इतनी अहम हैं that these conversations will carry on off this platform also. I think that is the opportunity that each one of us needs to take here, is कि जहाँ जहाँ हमारी synergy है और जहाँ हम ये बातचीत आगे बढ़ा सकते हैं और in collaboration काम कर सकते हैं, वहाँ हमें करनी चाहिए. Coming to आयशा लगारी, आयशा digital health की बात हो रही है और digital health platforms जो हैं, they are expanding quickly in Pakistan also. What potential do you see for technology to strengthen women's autonomy and access, reproductive information, and what risks must we guard against?
Thank you so much. I think I had a couple of things that I wanted to, respond to this question that you had, but I want to link up to what Ms. Tahera has just mentioned as well. Just to echo that the point that she's making around, and I'll get to my question in a bit. The point that she's making around giving women an agency from an economic perspective, this is one of the most important aspects which we have seen, and now we have evidence and we have data that supports that once a woman is given an economic agency, her decision making becomes a lot more in the household that she lives. At PSI Pakistan, we have rolled out a decade-long project whereby we have, provided skilled business trainings to women in deep rural communities across Pakistan, roughly around 5,500 women. These were women who were, before we started our interventions with them, had absolutely no, unfortunately, say in their households. But once they started becoming an economic or financial contributors in their households, their decision-making improved substantially. Not only for other household decision-making, but also from their body autonomy and decision-making. They started choosing the contraceptive methods of their choice. They started investing the money that they were earning into the education of their daughters. And we saw a dynamic change whereby the husbands who initially did not give a lot of importance to these, wives and mothers of their children started becoming second to them in their economic growth and, earnings. So I think that's a very, very important point, and we now do have evidence and data around that as well. With that, what I want to link is the question that you have asked from a digital perspective. The kind of population that we have, 230 million, and we know that that's also debatable, people in Pakistan. At the rate at which we need to reach out to every single individual, to sensitize them about contraceptions, to sensitize them about sexual and reproductive health, the 60% youth population that we have, it is very important that we start using technology and digital means to reach out to these people. Because if we keep on doing these manual ways of reaching out, we will not be able to reach the kind of reach that we require, the kind of touch points that we need with these people. Again, at PSI, we have launched a digital platform, which is a WhatsApp-based chatbot. The idea behind that was that nowadays, one of the most, we know that we have roughly around 190 million people who already have access to mobile phones. We know teledensity is 75.4%. We understand that women in most of these communities are not the owners of the cell phones or do not, whereby they get the internet connections, but at least every household has one cell phone. And Pakistan is also, I'm forgetting the exact percentage, but one of the countries where the penetration of smartphones is extremely high as well. That is an opportunity for us. The opportunity alongside with that also is that our rural communities are not as rural as our census, which is decades old. It's not as rural anymore. We are more of a peri-urban shifted country as opposed to having deep rural communities and cities. So we launched this digital platform on WhatsApp because we've seen that every household has access to WhatsApp now. We see in rural communities as well, and I go to deep rural communities quite a bit myself as well. We see that if they can't write or type, they at least send a voice note back and forth to people who are living in their cities, and they have relatives in the villages as well. And so we have a chatbot whereby women can get information in the language that is preferred to them. They can get the information on sexual and reproductive health, different kind of contraceptive methods, mental health has been integrated into it. And if you are the sort who wants to have a conversation with a doctor or a provider or a counselor or a psychologist, we have telehealth integrated into it as well, whereby you can, sitting in the deep rural community, wherever you are, using your husband's phone or your father's phone or your son's phone, you can reach out to a medical professional who is sitting in a city and get guidance from them. And when we launched this, we had a lot of criticism ourselves as well, whereby we were told how many people will reach out or won't reach out. We haven't really marketed it as much because we are not for profit. We have limited resources, unlike these for-profit organizations. But we have roughly around 300,000 people in no time who have started using this chatbot. The interesting thing in that is around more than 55% of the users of this chatbot are young adults. They mark themselves as not married. They mark themselves as young adults. And what's another interesting piece in this is roughly around 80% of the users are men, which is something that comes from our insights as well. But the topics that they're talking about are women's agency. It's about women's body. So what's encouraging for us from that perspective is that there are partners out there who are willing to provide support to their women. We need to tap into those kind of men as well. We need to provide, awareness to them. We need to, engage them and get them the right kind of information. The risk that lies in this is we need to be very culturally sensitive about what kind of content and information are we sending out, because while an opportunity lies, and I think there is a huge opportunity from a digital and technology perspective that we are not tapping into, we're completely not tapping into as much as we should, the risk is if we are culturally inappropriate, this is going to backfire, and then we will have, I won't name who, but the, kind of people who will start giving us, a pushback in this space. So I think we need to be very sensitive around what kind of information is being given. It needs to be medically backed. It needs to be spoken, from a cultural perspective. Women need to be kept in the center. Whenever we are talking to men, because through digital means, we are not having a one-on-one conversation. It's one-to-many conversation. What we need to be very mindful of is that men understand that they are being given awareness, they are being, provided this information to be a supportive partner to the women in their lives. It is not their decision to take what should be adopted and what not should be adopted. It is for them to be an informed partner so that a joint couple can make a decision together and women feel a little bit more encouraged. Youth, again, culturally sensitive in the right manner, but I think we've talked a little bit about sex education as well. It is important that our young people get to know about the body anatomy, about themselves, about the opposite gender as well, so that I think the information around the other gender, understanding your own anatomy and all of that stuff also leads to you respecting the other gender as well. And I think those kind of messages need to be pushed forward a little bit more also. So I think huge opportunity. Digital penetration, internet penetration, smartphone penetration in the country is an opportunity which is untapped. More and more it needs to be tapped in the right way, in culturally and religiously more supportive way, so that we take little by little steps to reach out to all of these people.
Thank you so much, Aisha. I mean, these are some really important things, and having worked in communities with young people, I think the appetite is very much there. The challenge which you are overcoming with this is also the challenge of the lack of literacy. And I think the content that we're putting out has to be one that anybody can access and use. And I think that's really important. And, cultural sensitivity is definitely important so that things can keep going. But we have to push the boundaries to ensure that the message gets out, because on ground, from where I stand, I think the appetite is very much there with young people wanting to have information and agency.
Absolutely. Just adding to that, I think that's a very important point you have mentioned. I think pushing the boundaries little by little is very important, because sometimes the absorption and appetite that we have, we know that the audience has a lot more appetite to take that.
Thank you so much for that. Coming to Dr. Qazi. Dr. Ghazi, given Pakistan's socio-economic divides, how can we ensure that reproductive choice is not a privilege for a few, but a right that reaches marginalized and underserved women, including those in informal and undocumented communities? I work specifically with people who do not have citizenship and identity, and that's why I've put in the angle about undocumented communities also, because people are left out of the loop. So how do you think that, we can ensure that the choice is there and it's not a privilege?
Thank you, Tahera. And this is a very critical question and a kind of a discussion that we usually don't have. And I'll take a cue from Tahera, who has really made the right statement, followed by Aisha. I would like to say that, we should make a position that a women autonomy and a women right to make a decision should be central to all the policies that we are leading. And when we say women and girls, it's not about who they are, where they are, because we know that in the data we need to be specific. We need inclusion in a true sense, not for the surveillance and not for the data, but for the very right that they deserve. So if they are not documented, if they're invisible population that we call, I mean, this is a very long struggle that I've had with the population ministry when it used to be a ministry. I remember after ICPD, I wrote a long 2-page email to the DG at that time. I said, you have signed ICPD, you have gone to the Cairo, the Prime Minister is committed, you're still asking women to bring her husband consent for tubal ligation, you're asking her to bring an NIC for a long-term method. Why should she do that? While a man who goes to vasectomy does not need a woman's permission, does not need anything. And the providers are denying services, and the woman, her husband is an addict or somebody who is a narcissist who doesn't want to give her the permission, and she's denied the services. And I said, please, you have to honor what you have committed. Let it be a women's right. And I know we have been saying women-centric, please put women in the center, but sometimes I also feel that when we say put women in the center, it's like 12 men are sitting and we are looking at women. Women bodies are treated as commodities. It's target-driven. And we have not even had that kind of give the leadership in women's hand, and that's what it should be. And it doesn't mean the women who are sitting at the top position, women who's walking into your facility. She should be the one who should know, who should have the right set of information, and she can take that. And we should not be worried about whether she doesn't have an NIC, she doesn't have a permission. Just give her the service she needs. And that's her right, her basic human right, and that should be non-negotiable. I'm a part of the Women in Health Global Network. I'm a part of Women in Health at Pakistan level. And what we have seen from what we have collected the work, that 75% are women in the health ministry at different levels, usually at the mid and lower level, the large percentage. But usually when you go to the highest, and now it is changing, I've seen a lot in federal, we have our DG sitting here in Punjab, we are seeing women secretaries, but you go to a health ministry and you see all men sitting there, and sometimes you get the pictures of a very important post-abortion care and postpartum family planning, and there are 30 men sitting with no women in the room. So what I'm trying to say is that unless you don't make women part of the conversation and you don't let them take their affairs in their hand, and that woman who's walking into the clinic, we should never underestimate a woman's intelligence, and anybody's intelligence, not women, a human. They would know best to do if they are provided with that. So we are calling of respectful care, we are calling of empathy, we are calling of compassion. The provider bias is very real, and the provider bias is extremely real. We need policies that have that kind of a surveillance, that where are the biases happening, and why a woman is refused a service when she walks into the clinic. And then the continuum of care, which is very important, from adolescent to pregnancy to postpartum. We know that at every touch point in her life, she would need that kind of information, which we fail to provide in a classical facility setting. Although we keep pushing women to go to a facility, and she should be in a facility, but then the continuum of care is not provided in the way that it should be. We have been calling out for the shifting the task, make the mid-level providers the kind of providers we have seen Sweden, going almost to zero their maternal mortality rate, mainly through the midwives. And we know that the lady health visitors and even the lady health workers, we are seeing Ethiopia and many African countries doing wonders with the mid-level provider, with the task shifting. We do have policies in one or two provinces, but they are not implemented in pure spirit. So what I'm saying is that we have to start doing that. And the most important point I want to say is that we need community-led accountability system. We just hired, of course, now I am also hired as a consultant for do this work, but I totally believe in, the community-led accountability project that I also got from Gates Foundation to come to Pakistan, that, let community hold the systems accountable. Because for them, everything is like, of course, it's happening, it's the will of the God sometimes, it's the apathy, the government ke idaaron mein to aise hi hota hai, they accept it as a fate, or the private sector to aise hi karta hai, no, hold the systems accountable, and they're the best agents to do that. And in that way, and we have seen the women groups that we have got collected in the community from a very, union council level to all, they would understand immediately what kind of rights they have as far as health is concerned, what kind of rights they should be asking for when they walk into the facility, what are the red signals that they should note, and what are kind of things that they can report back. So I think this is, of course, they need that kind of a agency and empowerment and a support in the system. I was telling, some of the people in the ministry that one of such projects in India was accepted by the government of India, and they have asked them to do it for them because they say our field is not able to detect what you could do. So you need that kind of a trust to build that, and you don't take it as a threat, that if a community is organized and is telling the health system, we are talking to PPH and SIN, they are very open, I must say that you need to rely on these mechanisms instead of, and in that, the undocumented, the invisible, the women who get sidelined, who get, sidetracked by the mainstream, within the mainstream population, would come out visibly. And I'll say the same thing for the young people, that the young people are the most vulnerable in the sense that if they want any sexual reproductive health services, and first thing they'll are you married? because, you know, in a facility, this is a question that is asked, and they are denied services of any kind if it is related to SRH. And I think in that sense, there is a lot of provider bias, the system bias, which push them back, and we need to start looking at this because the majority of this country are young people, and how can we deny them these rights? So I think there's a lot of things that needs to be done. I mean, it's like a drumbeat. We keep on saying that at all the forums. We are very happy to sit with the government. We have done that for various policies, various roadmaps, still working on some of very important, you know, factors. The postpartum family planning, Madhya is here, Dr. Shamama is here for the PPFP and post-abortion family planning. We keep putting abortion under the carpet, although 3.8 million women undergoes abortion in Pakistan every year. But we don't talk about it because, oh, no, it's a word and it should not be said. It's a health issue. It's an issue that a woman faces and she needs quality health care. Full stop, period. I mean, should not go into morality and judgment and all of that. And these are all married women. I mean, the Population Council and Good Market Study have proven that. So it's because of the unmet need. It's because the system is failing them. But we cannot leave them alone. So I think how do we bring all of this together that we are not just working on the surface, on a very clean kind of a population. Okay, you walk in and you have a straight record and we will serve you. No. I think, I mean, I'm a medical doctor and we take oath that we do that, but we don't see that happening in the real. And that is where we need to really start pulling all the lens together and where we can really move the needle, which we have not been able to move because we have been very selective in our approaches. We have been, you know, kind of, this is an approach that we will take. We have not tried to, you know, out-of-box thinking. How do we include, I mean, NGO and private sector, of course, have very flexibility, and they have shown the result in a much rapid way. They go to a community in 3 or 4 years. They take the CPR to the highest level because they are able to do all of this, which may be difficult in the larger public sector, but it's not something that cannot be done. And we would like to recommend that it has to be taken. The best practices have to be taken to scale.
Thank you. Thank you so much, Dr. Qazi. You know, I've been running a maternity home in a Kachi Abadi in Karachi for the last 12, 13 years. And it's primarily was run by midwives. And I think the fact that you have a facility, and it's a population of 800,000 people, you have a facility within the community really makes a difference in terms of accessibility and in terms of building that relationship of trust where you can make the change that you're speaking about. I'd like to come to Shamama now. I mean, one of the things that I was reading just yesterday was about the first ever diversity, equity, and inclusion policy in the petroleum sector at ODCL that you have been in the forefront of. And in the light of that, I'd also like to talk about, I mean, I'd like to know how that is and how it's been, you know, received and what the impact has been and also what the challenges are. And in addition to that, you have decades of experience advocating for women, from leading the Women's Chamber of Commerce and Industries to your current role. From your perspective, how does empowering women and expanding their choices influence Pakistan's population growth and demographic future?
Thank you, Tahera. Whatever I'm going to talk about now is going to come from my experience, coming from KP. First, I'm going to focus on economic empowerment and empowerment, which will help stabilize the population. I've noticed throughout my journey and my extensive experience with women of KP that giving them, talking about rights and just telling them about the rights that they have always creates a friction because on the other hand, we are not educating their counterparts. We are not educating the men in the family. So for empowering women, we must at the same time educate men also. And that's how the tug of war will not take place. They will be empowered. They will know what their power is and exactly what their choices can be. This given alone will never work, and it has not worked anywhere, and it will not work because that creates a lot of friction. Whenever a woman is empowered, she's able to make the decisions that already discussed here. Even when they sell eggs in the village, they come to me and they say, now we have a decision-making position in our house because we are able to give 5 rupees, 10 rupees to our children, and our husband sees that. So when we talk about empowering them, all of us who are sitting here, it shows that we have our commitment to the cause. And for this commitment, we will have to make more space for women. And that's what I've been doing also, and that is related to how I slowly graduated and reached the boards of different companies, and where I had to, advocate for creating more spaces for women. So when we talk about creating, we have to take all the other people sitting on the boards, all the other decision makers sitting with us as a team. We have to take them with us. And that's how the first ever diversity, equity, and inclusion policy was rolled out in petroleum sector. It was a new thing, but it was very well received. And due to this, because first we made the base. We just did not start talking about making more space for women or empowering them. We made the base. We rolled out the diversity, equity, and inclusion policy. And on the basis of that policy, the first ever female management trainees cohort was taken in the petroleum sector. It had a lot of backlash. It was not received that well in the beginning. But with the results, the place women have carved for themselves, because they were ready. We didn't have to, open the doors for them. They were ready there, and I think it was great. They are now the great asset to the petroleum industry. Now, making spaces, when you talk about making spaces for women, this is how the space is made, and the space is made in the fields also, where they want to go. This step needs to be taken by people sitting here. These are bold steps, but I assure you, if we go ahead in a team, we make teams, we share our vision with our male counterparts, I think we can very well achieve all the goals that we have for making more spaces for women. And one thing is that we don't need permission. None of us need permission. Abhi, Tahera Abdullah Sahiba was concerned, but I said we don't need permission. If you want to speak and if you want to bring something and share it with our audience, I think we don't need permission unless. So we have to be sure that when the better half of Pakistan rises, the other half of Pakistan also rises. So we must empower them, and that empowerment has to be majorly economic empowerment. And for that, I will go back and say that we have to make more space for them. And that spaces all of us can do if we join hands. One request to the Dawn Media today is that by the end of the conference, we should have a white paper, and all of us should have some commitments from our side that this is a small change, a small policy change in our respective organizations that we pledge that we are going to make to control. And sorry, I should not be using the word control, and I've been reading so much about the word control that now I'm saying control. Let's not talk about control. You see, we need to stabilize. We have to empower them. They have to make informed decisions. And we have to we talk about stabilizing and also not controlling the fertility also, please. Fertility is such a beautiful thing. It's such a beautiful thing. Why do we want to control it? We should rationalize it. We should give them enough knowledge, enough information where they can decide exactly how they want to use their fertility, but not control it. Thank you.
Thank you so much, Shamama. And I think, making the impact around us in small steps, I think, is the first step towards change. Madiha, last but not the least, you have worked extensively at the intersection of gender, bodily autonomy, and feminist policy advocacy. In today's political environment, what strategies are most effective in ensuring that women's reproductive choices are recognized as fundamental rights and not optional services. I think the fundamental rights aspect of it really needs to be talked about.
Thank you for that question. And I think after hearing everyone on the panel, I don't think there is room to deny that reproductive health is a human right. And what I think we need to shift conversations around is that reproductive rights is also the fundamental for gender equality. If you're not going to fulfill a woman's reproductive and sexual rights and needs and health services that is required, to expect her to be a participating in formalized labor forces, or being able to educate her daughters, or being able to push back against traditional archaic practices like child early age marriage is just not possible. So when we talk about women's reproductive rights, it should not be starting at the time of her pregnancy. Reproductive rights starts the minute the child is born. And since she hits puberty, what are we giving her in terms of her ability to negotiate sexually? Why are we still turning our faces around to gender-based violence that occurs through and throughout our homes and our societies? We constantly put women at the center of honor. Why? Why are our bodies linked to honor when honor comes from good homes, good values, societal and collective care? So for me, reproductive rights is not just a human right. It's the fundamental for gender equality. And if we are to meet these sustainable development goals that we have committed to, we can't do that by putting reproductive health as 3.1 or 3.3 just within the, as a checklist. It is integrated in every aspect of human life. So when we talk about education, where do we begin education and how do we integrate reproductive rights within education? We can think about best practices from across the world that look at menstrual information, awareness, and management as a key part for sexual negotiations later on in the world. That's how a woman can regain her control and be able to negotiate when and who and with and how she'd like to have sex. We can also then bring in the aspects of when she would like to practice safe sex. And that is also a critical importance. I think censorship is not the way to go anymore, right? Like, we need to be very clear that young people are having sex and they're having unsafe sex, and then they're resorting to other options as well. Yes, data is showing that married women are the ones in Pakistan that are generally going for abortions, but there are a large number of women that are using the emergency contraceptive pill as a key mechanism of avoiding pregnancy post-sexual encounters. But then there's also the aspect of where are we integrating this within gender-based violence policies, right? Right now, I think we're at a critical stage where we're seeing in Pakistan a huge rise actually in gender-based violence and instances, occurrence. Maybe it's reported more, we don't have enough data to justify either or, but the idea and the baseline is that we're seeing more and more reports of violence that is against women, whether in the form of rape, whether in the form of murder, whether in the form of assault. So our medical legal services need to integrate emergency contraception as a key part of service delivery, and that is also a part of her reproductive rights and health. And then as we move forward, marriage, the nikah nama, all of those conditionalities on that piece of contract that we talk about are ways that women can ensure protection and safety for themselves. And last but not the least, I want to talk about the fact that when we talk about economic integration of women, we cannot do that without really critically analyzing the availability of care infrastructure. Because women, unfortunately, have to bear the burden of family raising, child raising, domestic responsibilities, taking care of their homes and working full-time. Full disclosure, I'm a full-time mom. I'm also a full-time working woman. I work on average 8 to 10 hours a day. I take care of my kids. And when I had my second child, I demanded a tubal ligation. I was 34 when I did that. And I could not have done that had I not had mentors like Tahera, like Yasmin, allies like Aisha, who constantly talk about the need for us to make our decisions. Women are infantilized when they go into these emergency rooms or when they go to these providers. So like Dr. Yasmin said, provider bias is real. And providers are the ones who are discouraging a lot of these management or fertility management techniques, where they're telling you, you're too young to make that decision, or you only have one child, why do you want to wait for the next one? Who are these providers to make those decisions for us? And it's because of the narrative. It's because that women are seen as inferior. It's because that women are not seen as people who are able to make the decisions for themselves. It's not just about affordability, right? So we need to stop thinking that women don't know what they want, women don't know what they need, and women don't have the tools. We have all of that. We don't have the systems and the support to make it happen. When we talk about economics, what about sexual harassment at work? It is a very critical problem. Tahera ma'am has done a lot of work in this area where there are actual cases that have gone on for 4 or 5 years on sexual harassment. Why shouldn't women feel safe at work? And yet we don't. We don't have protections in place that allow for breastfeeding. When we talk about nutrition and breastfeeding, but we don't give space for women to breastfeed safely at work, what really are we constantly arguing about and going back and forth? So at the end of the day, I think I'd like to end with that without reproductive rights integrated across social, economic, education, health, development, and without appropriate budgets allocated by the health, by the population, women development, social development, disaster management authorities, even in terms of flooding, we had so many women pregnant in 2022 and even recently. None of the emergency cares had EMOC services properly integrated. We didn't have family planning services properly integrated. This was all reliant on CSOs and INGOs to deliver. So when we talk about accountability, I agree, community-led accountability needs to be there, but the systems also need to be accountable. They need to be financing this appropriately and proportionately against the policies that they themselves have committed to, whether it's the ICPD, the CEDAW, the CSW. If you are not going to allocate appropriate human capital as well as financial capital and technological capital to ensure that women can get what they need, I don't think any of this is possible. So these conversations sometimes feel like cyclical almost, but to me, like you said, integrated services, integrated across all levels of services, not just health, and then of course creating accountability for both the private sector and the public sector to ensure that spaces that are created for women are women-friendly, are appropriate, and take into consideration the lived realities of women. Thank you.
Thank you so much, Madhya, for ending on such a powerful note. I'd like to thank all of you for being here today, and it's been a phenomenal learning experience even for me. I think that we're all going to take something from the conversation today and take it forward. We've highlighted that empowering women's choices isn't just about policy and passing laws. It's about enabling informed choices, shifting social norms, and ensuring access to resources, opportunities for all women. Thank you so much.
Thank you to our trailblazing women panelists. That was a power-packed session. I'm gonna invite Laila Azhar, Chairperson, National Commission on the Status of Women, to the stage to deliver her keynote address for this session. Thank you.